got some of my own mea culpa and my own learning point in that space. And I think it gets back to a lot of my public health background. I've done a lot of foodborne outbreak investigations and workups. So I have been very paranoid about food. So we've had an interesting learning curve change in terms of our own thought processes. I don't know how much we're going to increase eating out, but again, that's for a little bit later as we get into the topic for today. Upcoming topics, again, coronavirus impacting the immune system, and again, more information on testing. Carl, if you could, please let Chris know. I think he needs to update this upcoming topics section. For those of you who haven't seen many of these videos, we've got a lot of information on the blood clotting complications. It's, we had a healthy young actor, Broadway actor, lose a leg because of blood clotting. There's a lot of information, a lot of concern about blood clotting problems, even major strokes with young, healthy people, as in 30-year-olds, compared to what you usually see with strokes in 70-year-olds. So big topic. Pulse oximetry and the silent infection that's killing us. That was a topic that was suggested by Joe Riley. And again, very interesting, very helpful topic. It's a great way to think about, a lot of people are thinking about, how do I know if I'm really sick? If I do get COVID and I'm staying at home because I don't have a problem, there's concern about that because this virus is unique in terms of dropping our oxygenation level, decreasing our ability to oxygenate, and we don't know it. So pulse oximetry is maybe a way to keep screening on that and make sure that you're healthy enough to stay at home. We've got a video on that where we discuss it. Effective treatments, again, a perennially interesting topic. Pregnant women and kids, and 6 conditions for ending lockdown. Now, I've had a lot of questions. Just a couple of quick items about other services, educational information that's available to you that we're working on. I've mentioned the book a couple of times. Get a lot of questions about that. Yes, we're working on it, but there's 2 of us, myself and Todd Eldridge, who runs the CIMT company. And because there's 2 people, I'll work on it a little bit, then I'll hand it back to Todd. He and I have been through that iteration several times. The last time he gave it to me, I didn't even know that he had given it to me. So it's just like delay after delay after delay. You don't really care about that. You care about when it's going to come out, and you care about basically what it says for you. And here's what it says for you. It's in the title, What a Stress Test Can't Tell You. 90% of stress tests are done to predict a heart attack, and they don't do that. I hate to tell you that, but it's better to know the truth. Up until COVID-19, we were doing, 8 million stress tests per year. Somebody made some comments about this recently and said, well, a nuclear stress test is much better. Well, it's like, it's still no good. I mean, it's like Google false negative stress tests, and you'll get the Google snippet, the station 0 on the search engine research page or ranking page. The snippet will be from the NIH, and it'll say 1.5 million of the 8 million are wrong. So even if, and 90% of those, again, are nuclear stress tests. So it gets back to the old Dirty Harry quote. You go get a stress test, you got to ask yourself, am I feeling lucky? Now, there are better options. CT angiogram, CIMT, which you might have guessed with my co-author being a CIMT guy, and calcium score. Each of these things, though, has its own unique characteristics. Calcium score is, it's great for a one-time screening. It can't tell you what's going on year by year. And with our patients, one of the things we demonstrate is, yes, you can predict a heart attack, and yes, you can show decreasing risk. There's no question about that. You can't do that so well with coronary artery calcium score. You can do a little bit with CT angiogram, but that's really where CINT comes in. Again, as you notice, the basic ones that are being used over and over again in our country, because we're wealthy and because that's what we all think we need to do, are a stress test with a positive stress test, whether it's false or negative, false or true positive, leading to a trip to the cath lab. And don't get me started about a cath lab. That's sticking a needle and a catheter up into the arteries of your groin. You really need something better than that combination. So I'll leave that alone. I will give you a little bit better information once I find out from Todd when we plan to, or when we will be able to publish. If you're interested in finding out, do I have risk for heart attack and stroke, and finding out a lot better than what the standard of medicine is today, then this is a great way to do it. As you may, if you've seen many of our videos, you know, really the majority of plaque is associated with inflammation, artery inflammation, and about 80% of that, maybe more, is associated with undiagnosed prediabetes. And bottom line is, docs these days are just not that good at diagnosing early, subtle prediabetes, the kind that causes plaque. And as we mentioned with the stress test, you don't have to have plaque to occlude the blood flow. Just a minor amount of plaque, if it ruptures and spews into the bloodstream and causes a clot, and the clot's big enough and it goes to the heart, that's what a heart attack is. So we're talking about just any development of plaque. And you don't need to have very much for that to happen. This is not 10% of heart attacks. This is not 15 or 30 or 50%. This is over 90% of heart attacks, that same mechanism. And we're not looking for it. So again, a great way to find that out. Michelle can give you some more information, as can Lori. And we're doing a webinar on both insulin resistance, cardiovascular inflammation, and now Michelle's developing one for CINT. There are a lot of people out there. There are folks like David Meintz, Dr. Doug Thompson, the dentist that's been on several times, and Todd, all of whom have done CINT events, but they really didn't have a physician available to talk to the patients. They got a lot of people with positive results. They took these results back to their own doctor. The doctor has never seen these before. And he said, well, if I'm a doc, I'm the expert, and I've never seen it, it's not any good. It's of no help. And again, so many people got great warnings for what they need to know about their own heart attack and stroke risk, but didn't went to the wrong resource and didn't capitalize on it, weren't able to benefit from it. So again, we've got access to you for a doc who knows how to interpret these and get you started on what you need to do next. And again, the last service comment, we've got still have both preventive medicine and more so urgent care type of visits available to you, assuming you can't get access through your doc. And that's a big issue. So we'll get to the feature program for today, and that is takeout food. And again, I'll do my own mea culpa, and we'll talk about a little bit more details from some real experts in that area. Right after Carl shows the water ball, and then we'll talk about, at the end of it, we'll do a video which covers a little bit more detail. Carl? So, so here's the question. Is it safe to eat takeout? Now, I said that I was going to do my own mea culpa. Like I said before, I've done a lot of work in foodborne outbreaks, both in some of my original public health days in places like prisons, major problems there, and in some of my mid-career work. Mid-career, I was in Manhattan. We had about 50 different contracts. Probably half of them were with the large financial houses. And a lot of those financial houses had very large cafeterias. It was unusual in that day to provide food to workers, at least high-end food. But they did that because they had, bond traders and guys that every hour off the trading floor, they were losing mega bucks. So several times we had episodes where Wall Street got shut down because there was a foodborne outbreak. So given that kind of experience and background, I was really nervous when we started lockdown for coronavirus, SARS-CoV-2. Now, Janice and I got a head start on the lockdown. We started our lockdown about March 3rd. So we're going on 7 and 8 weeks now. We have had takeout once. It was Janice's birthday. It was last week. And I didn't know how much I missed that kind of food, somebody else's food. It was wonderful. Each of us, we have different patterns. I tend to eat a lot more low carb and do some fasting and stuff. And Janice doesn't do that. So we each cook individually. Occasionally we'll cook for each other. And you get tired of cooking your own food. I mean, it may be good. You may like it. For the most part, I feel like I don't get enough access to my own and enough time to cook my own food. But it was nice. So before we did that, we had done a couple of videos where we're talking about, what we're nervous about ordering out. But let's see what the experts say. With the coronavirus spread and stay-at-home orders, takeout and delivery of prepared food has picked up in the U.S., but is it a good idea? Many food experts agree that restaurant food is safe to order during the outbreak. If you think about it, what have you heard? You haven't heard a whole lot of stuff about transmission of this virus. When it comes to food and coronavirus, the biggest threat is person-to-person contact, which it's been from day one. Here's a case, or a point. No evidence, like I said. You just don't hear about spreads, about outbreaks, about transmission through this mechanism. And this type of eating has increased dramatically as going and sitting down in a restaurant has fallen off a cliff. There's no evidence to suggest that food produced in the United States can transmit COVID-19. That's an FDA statement. The coronavirus primarily spread via droplets expelled through coughing, sneezing, or talking, and touching a surface with the droplets. Therefore, transmission with food is not as likely, unless the food is inhaled, and obviously you're not. Sometimes my mom and others have accused me of inhaling my food, but that's a different issue. If you're uncompromised or just feeling extra worried, consider cooked food only. And that's what we're doing now that that's what we did that one time. We're changing our behavior. We'll probably have it more often. Here's the second point. Food establishments have rules on safe food handling. Now, again, that's where I get back to some of my old outbreak investigation days. Wearing gloves, staying at home when sick, and frequent hand washing, surface disinfection. Yes, they do have those. That's a whole part of what goes on with restaurant quality inspection. And again, I've been on a few of those restaurant quality inspections, and that again created some of my cautiousness about it, eating out or ordering out. Establishments can't operate without at least one person trained in food safety. FDA's new guidance on food safety and COVID-19 added a 6-foot distance between food workers. So at least they've made a nod to this issue. How safe is it to eat takeout? Coronavirus was detectable up to 4 hours on copper, up to 24 hours on cardboard, and up to 3 days on plastic and stainless steel. That was from one of the top 3 medical science magazines in the world, New England Journal article. And again, that's part of what made me nervous. Food comes in cardboard packages. So take precautions on social distancing and surface sanitization. Take a few minutes to create a safe food environment when the food arrives by cleaning any surfaces it will touch. Pay and tip in advance. I can tell you, very few people are paying and tipping in advance. We could tell that because that's what they told us when we finally ordered out. They said everybody just gives us the credit card when they get here. Well, the credit card, I mean, that's taking a credit card and passing a fomite. A fomite is something that can have your germs on it. And that's exactly what a credit card is. So let the driver leave the food at the doorstep. Wait until the driver is at least 6 feet away before picking up the food. Remove the food from the takeout bags or containers. Dispose of or recycle them appropriately. And after disposing of the packaging, wash your hands for 20 seconds with soap and water. Wipe counters and other surfaces when you've unpacked the food. So yeah, there's still a lot of that surface containment discussion and concern that you need to have as you do this. So Carl is going to show us a video. It's a little bit longer than our normal clip. It's a full 2 minutes because it gets into a little bit of the cause and some of the background on this issue, and then it gives a little bit of advice. After that, he'll give us an intro and we'll go into Q&A. Carl? So thank you, Carl. So we've got a few people asking questions about it right out of the blocks. Joe Riley saying, what about microwaving the food in container for 2 minutes after having it delivered without contact and wearing gloves to get it off the porch and into the microwave? That sounds pretty good to me. I don't know what it's going to do to the food, but it's a good question. In the environmental stuff that we've done, as you know, I'm working with a group that's doing environmental cleaning as well as return to work for large employers. And basically, they've continued to focus on weak acid solutions to clean this. Obviously, you don't want to put that on your food. And again, I don't know about 2 minutes of, I think 2 minutes might be rough on some dishes, but I think it'd also be rough on that virus as well. Thomas Russell, TGR, I think maybe that's your initials, not sure, wasn't clear. Robert Simpson, good morning, Mr. Greatness. Thank you very much, Robert. Joe's talking about his O2 sat on his oximetry, 95% and 73 beats per minute. So looking healthy, Joe, at least from that perspective. Terry Wyatt, good morning. Can you advise niacin dosage, please? Thanks for this work and information. So it's a good question, Terry. Niacin, actually, we've set up a couple of things where Lori, our nurse, helps folks get started on niacin. I could go for about 20 minutes just on that topic alone. The simple dosage question is this. The goal is 2 grams. Now, a lot of people just can't tolerate 2 grams. And if you talk to cardiologists that use it, if you talk to prevention guys that use it, you look at the literature, there's a pretty good case to be made that, look, you don't get that much of an effect under 2 grams, but I can tell you from experience, that's not true. I've got a lot of patients who just can't get beyond a gram or a gram and a half, and clearly are getting increased HDL, decreased LDL, significant decreased Lp(a). So thanks, Carl. I forgot to put that up there. Ted Tingray missed live yesterday. Good morning today, though. Thank you very much, Ted. And thank you for that super sticker. That's fantastic. Again, I appreciate it, guys. I'm supposed to be retired 3 times now, and as I've shared with you, I'm doing consulting now for a couple of other groups. I'm just I enjoy what I do. One of my biggest passions is the problem that people think that you're just going to have a heart attack, you're just going to have a stroke, you're just going to die, you're just going to be disabled in your 60s and 70s because we can't really predict that. Nothing could be further from the truth. And that's the purpose for this channel, to get folks to begin to understand it's not just the standard, get a stress test if your brother-in-law dies, or get a stress test if somebody in your family dies to see if you're going to have a heart attack, and then take some statins and hope it doesn't happen. That's not the way to do this. But unfortunately, that's the way too many people's health and lives are being treated. So, caveat emptor, buyer beware. It's unfortunate that has to happen with your health, but it does. And this is, our goal is to provide free information. For those of you who have appreciated the information, we appreciate your donations and your help in terms of helping us get that out there. When I'm back on retirement mode, we're basically spending our retirement money in order to support the channel. And we get a little bit nervous about that. So that's the reason that I see patients. If you look at our finances, when I'm working, and most of my money, not most of it, but it goes into paying for the channel. The channel's not so much self-supporting. We did, after I left, start, quote, breaking even, but that, again, was without paying me. I don't need to get paid from this activity. I just would very much like to grow the channel. Not trying to make money, trying to grow our impact, because how many people are dying from heart attack and stroke? And guess what? The same people are dying from COVID-19, plus a few more. Erland, good hearing from you, Erland. Hope you're doing well. From Beaverton, Oregon. Chuck K, why is it so hard to find the location to get CINT tests? I don't think my cardiologist can spell CINT. He or she probably can't. Here's the bottom line, and this is, again, part of the book. We go into depth and detail to explain why the standards committees are only now beginning to warm up to CINT. And until the standards committees warm up to CINT, they are, it's not going to be very popular. Bottom line is garbage in, garbage out. You see so much of the science about CINTs that's really bad. And it was done by someone who did not know how to do a CINT. And they did a study and they didn't find anything worthwhile. They messed it up. But unfortunately, that's sort of like me going in and doing surgery on a belly and on a bunch of people's abdomens. I'm not trained in that space, and then I go out and publish an article that said our outcomes were awful. Well, of course they were. I wasn't trained in doing it. And that's exactly what you see in the science of CINTs. Now, if you go deeper into the science, and they share their exact techniques on how they found the artery, how they located it, their angle of approach. When they do that, the science is just crystal clear. It's very, very good. Now, Todd has actually spent some time with some of the standards committees. I believe it was the U.S. Preventive Services Task Force a couple of years ago, and they began to see that after they finally began to start listening. So that's why you don't see a lot of them out there. And I think it takes forever to move the medical community. I think it's going to be many years before you see a lot of CINT availability. And of course, in the age of COVID, it's taken a huge toll on Todd and a couple of the other sources for doing that. Robert Simpson, yes, takeout is okay to eat. Thank you, Robert. I've seen people wearing masks while jogging. Is that going too far? You know, we got word, I live in Kentucky now, in Lexington, and we got word from our governor that we're going to have to wear masks anytime we're out. That was my immediate question. I run pretty hard, 2 or 3 times a week, and because I do some aerobics, I do some jogging for about half an hour, and then I'll do several different types of high-intensity intervals, some flat high-intensity intervals followed by some hill intervals. And wearing a mask when I do that, that's going to be a challenge. And I don't really think, it's clearly not necessary to wear a mask when there's nobody anywhere near me when I'm doing this kind of running. I don't know. I haven't been out there and tried that yet. We will see. Yeah, I'm clearly going to try it for 2 reasons. Number one, I think if people don't, if we ignore laws or regulations or edicts from our government that we don't entirely agree with, or that we don't think are, there are exceptions, but we're not going to, if you don't follow it, you create an environment that's just not good. The other thing is, I'll probably slow down the intensity of my physical part of my interval, but it'll still continue to stress my my cardiovascular system, because I've got a bigger resistance now in terms of actually getting that air, the oxygen in and the CO2 out. David Ivers, good morning from beautiful SLC. I don't know, SLC. Don't know where that is, David. Erlen, I found CINT test location through CardioRisk at cardiorisk.us. Thank you, Erlen. And yes, Todd is still doing some of these. I'm not sure how and in what type of environment. But yes, CardioRisk they're the guys that I use. They're the only qualified national provider that I know of that goes through all of the different fastidious technical training and quality programs. So I use them on a regular basis. Again, their owner is Todd Eldridge. He's the guy that's been on this channel several times, and the guy that I do some of these events with. When David Mites, for example, does these CIMT events, the CIMTs are being done by Todd Eldridge's CIMT techs. Erland, joggers need face masks because they pump out more vapor than anyone else. That's true. The question is, are they jogging within 20 feet of anybody else? And if they are, then yes, I would agree and understand. David Ferguson, how effective is heat at killing viruses? How much time does it take to kill most viruses at 150 degrees Fahrenheit? 107 degrees, 175 Fahrenheit, 200 Fahrenheit, and 212 Fahrenheit. 20 minutes, 30 minutes, no, 20 minutes, 15 minutes, 7 minutes. Obviously, I'm making that up. I don't know. It's a good question. And I will also say, I mean, it also, when you say killing virus, on what surface? On your skin? On a metal like copper? On plastic? On cardboard? This gets pretty complicated. Steve Mitchum, buying raw produce seems risky. You don't know who's been talking over it. And it's hard to wash it. I agree, Steve, that we are not, and I used to get a lot of fresh veggies, and I'm not so much now. Used to do a lot with broccoli, and I'm not doing any fresh broccoli anymore. I eat a lot of cauliflower, but it's cauliflower that has been riced. So I use it in those dishes. I miss the fresh veggies. And actually, if you look at it, there are articles where both milk and fresh veggies are just being, fresh milk's being poured down the drain, and the vegetables are being trashed and used for mulch, because people are, I'm not the only one who's worried about that. Greg without diabetes. Greg without diabetes, I have to ask you the question. Number one, why did you have that name? Very interesting, especially in terms of what we do with this channel. And number two, how do you know? Have you had a CIMT? Have you had a OGTT? Have you had an insulin survey? Or are you just talking about hemoglobin A1C? Because hemoglobin A1C is not that good at ruling out diabetes. The thing that scares me about sitting in a restaurant, aside from being in the confined space with other folks, are the thousands of items handled by other folks. I agree, Greg. And again, even though you cut way back on that when you're just getting the food on takeout, you still have that fomite issue. And for those of you who don't know what fomite is, fomite can be anything from headphones to a pen to a box that food's delivered in that someone else has touched. A fomite is something, a surface area that can be used for transmission of disease. Thank you, Greg. Bart Robinson, I for damn sure am not jogging with a face mask ever. Thanks, Bart. Steve Mitchum, please like, comment, and share these videos, everyone. Share on Facebook and other social media to keep the channel going. I appreciate that, Steve, and I would agree. Like I said, I'm putting a lot of hours in, and we're trying to save lives. Now, we do get a lot of feedback. If you watch the channel comments, a couple of times a month, I'll get somebody that says, Doc, hey, I got the OGTT, or I got the test that you talked about. And no, I didn't have prediabetes. I had full-blown diabetes, and my doctor's been telling me I was okay. That's not uncommon at all. Erland, face masks are not for your protection, but for the protection of all around you. Not wearing a mask is selfish. Greg without diabetes, because of you, I'm working on it. Well, good. Thank you very much. Chuck K, any thoughts on when you'll start at the road shows? That's a great question. David Mintz, as you know, has been doing a lot of road shows, and we had to cancel about halfway into the events, a lot of IMT events. As we start getting the economy back up and rolling, we look forward to being able to do that, to offer a good quality IMT to folks. Great question. We'll post you. We'll let you know when we do. Steve Mitchum, SLC is Salt Lake City. How could I miss that? You know what I thought? I thought he meant South Carolina, but I didn't know where the L was going. I'm from South Carolina. Nancy DeBosek, Salt Lake City, SLC. Thank you, Nancy. David Ivers, can you let your fresh veggies sit in your crisper for 48 to 72 hours before eating? Well, of course you can, but the question is, does that really, if there's coronavirus on it, does that get rid of the coronavirus? And from the information that you saw from other different groups, like the New England Journal article quote, a lot of these viruses are being picked up and cultured after many days on a surface. Jackie Shaheen, are you familiar with the supplement H2 Max? There was another Max that I was talking about, that I did a video on, and it actually resulted in some liver injury. It was, and actually a couple of deaths. I don't think it was this one. It's the ones where you're trying, it's called cutting, where you're trying to burn calories, and it's sort of like the old epinephrine, adrenaline kind of things, where it's helping you burn. The idea is to burn fat. Again, very, very, I think that's very different. I don't think it's H2 Max. With Jackie saying oxidative stress is fast acting, reduces the COX-2 enzyme. I haven't heard of that. Very interesting. Thank you for your comment. SNC Nutrition. If we change out our own plates at home from the food containers, from the takeout, and then heat it up, will that suffice? Well, that's what we're doing. And again, that's what I think part of what Joe was suggesting. And that's what you saw on the video, the clip that we just showed a few minutes ago, that take it out of that cardboard container that you got it in, put it in your own plate. Joe Riley, thank you, Joe, so much. Hey, everyone chip in a few dollars now. Thank you so much, Joe. Again, I appreciate it. And I have to tell you, I was getting frustrated a few weeks ago when we were doing a lot of this work, and the views had dropped significantly. And a lot of it was because once COVID happened, people stopped worrying about long-term heart attack and stroke and living 2 more decades. They just wanted to live through the next year. We did start adding the daily COVID stuff and trying to make the point that it's still the same issue, guys. It's still lifestyle. It's still your diet. It's still what you eat. And guess what? COVID-19 is a serious disease associated with SARS-CoV-2, of course. But the folks that are getting COVID-19 from SARS-CoV-2 are the same folks that watch this channel and the same folks we've been dealing with. Prediabetes, heart attack, stroke risk. Those are the folks that have risk with SARS-CoV-2. So it was interesting, Joe. I think it was not Dave Murphy. Dave Murphy has contributed. A couple of other folks have, but somebody started this trend of doing the super chat, these super chat buttons and the contributions, and then others started going to Patreon, and some others were doing. Oh gosh, what do you call it? PayPal. So we've got all those set up. They were a huge shot in the arm, because it began to feel like, gosh, you know what? I'm not the only person out there crying in the wilderness. There are other people that are concerned about this too, to the extent that they'll go ahead and put a few bucks where where their mouth is. And I greatly appreciate folks doing that. Thank you so much, Joe. H2 max is just magnesium malate. Oh, okay, great. H2, magnesium's a big deal. All of us, maybe not all of us, but the vast majority of us are magnesium deficient. And that has a lot of impact in a lot of places, ranging all the way from mental health to cardiac dysrhythmias like atrial fib. So I suggest that everyone do some type of magnesium supplementation. I would also suggest that you include magnesium threonate because it's the only, there's a significant amount of evidence that magnesium threonate is the only type of magnesium that gets across the blood-brain barrier. And as I mentioned, magnesium deficiency has an impact, shows evidence of having impact in terms of mental health, all of this depression, anxiety, things like that. Thank you, SNC Nutrition. Lance H., I work in a fast food place, and all of my coworkers are over 21. Oh, all of my coworkers over 21 are overweight. Yes, huge, huge issues. Friends don't let friends eat fast food ever. I don't. That's tough, working in a fast food place and having to deal with that issue. Thank you so much for sharing that. That's again, that's got to be a big challenge, Lance. I will tell you, somebody asked, I got a comment last night. They were talking about that video clip that Janice showed when we were in the car, and I was reading these commercials for fast food because I had not eaten anything other than my own food for quite a while. And he said, I don't understand why you're missing fast food. Well, the reality is I rarely eat fast food. When I do, there are some healthy alternatives, believe it or not. For example, you can get a grilled chicken in a lot of fast food places now, grilled chicken salad. Now in the age of COVID, you know, you have to worry a little bit more about the salad like we discussed a few minutes ago. But if you look hard enough, you can often find not unhealthy solutions or alternatives in a lot of these places, even McDonald's, for example. But you got to look, and you can't get, obviously, the milkshake and the Big Mac and the big, you know, the giant fries, which is unfortunately what way too many people get. And that's what's taken us down that obesity pathway. Cheb Tingray, Clenbuterol is the beta agonist cutting agent I know of. Oh, okay. Thanks for sharing that, Tab. I can't remember. I'm having a, well, I started to say senior moment. It's not a senior moment. That's a relatively arcane term about the medication that resulted in that liver disease and death. Again, I did at least one video on it. Dave Ferguson, no CardioRisk in my area. What's the best IMT hardware and software to look for? It's not so much a hardware issue. There are some hardware criteria, but the really big problem is, again, it's not so much software either. It is technique. It's where you, here's the thing. I don't have my little model of an artery. We make assumptions that if this is the artery tube, we make the assumption that plaque is uniform around the circumference of the artery tube and longwise as well. And neither one of those is the case. So if you're looking at and measuring that plaque, which you can do with almost any of the IMT software and almost any of the standard ultrasound hardware, the problem is if you take a picture from here today and then change the angle slightly or the location slightly, then you can get a whole different reading a year later. And that just ends up creating the chaotic noise that we saw in the research. So again, David, it's a great question, but it's not hardware, it's not software, It is fastidious technique regarding location, 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 and angle and things like that. Some do both. Not sure. Some do both. Joe, what you were talking about there. Dave Murphy, thank you so much, Dave. Yes, Doc, we do appreciate all that you and your team are doing. Thank you so much, Dave. Lance, the grilled chicken is cooked in hydrogenated soy oil. Oh, I see what you're saying. Yes, it's a good point. Good point. I will tell you, I'm guessing you haven't read, what is it? There's some good books. I can't remember the name of the book recently about, that I read recently. It's a few years old. It's about fat and these assumptions that hydrogenated oils are bad. There's a significant debate around that issue, but I get your point. Very few things, you can control very few things in terms of quality of food and in terms of the health quality of that food when you order out, especially at a fast food place. Joe Riley, can we move comments when you don't have time to posting area below the post? Yes, we do, and we do have that. That was, I respond to those as much as I can. Since we started doing the, and I still do, I have to tell you, I still do get some response, a lot more responses than most channel owners. But when I will tell you this, once we got started with helping these employees on return to work, my time is getting crunched right now. So I respond as much as I can. I'm not responding quite as well as I was 2 months ago. Joe Riley, thanks, Dave. And I appreciate that. I'll say that again too. Thank you so much, Dave. It's a great example for others. We appreciate folks helping us get that word out. Steve Mitchum, I've learned so much from this channel, Dr. Brewer. I'm going to miss these live streams when I go back to work, but I'll be able to donate. Thank you so much, Steve. That's wonderful. I do greatly appreciate it. And I'm glad that you're getting a lot out of it. That's the whole purpose. So that's the end of our comments and questions. Thank you so much, Steve. Carl, I think we're ready to go.